traumas that so many Americans endured as a result live on in those communities and in those families today. It's why the American people made this solemn promise to never forget the sacrifices of our first responders, and why we created the World Trade Center Health Program in the first place, to give them care. So we will not waste any more time fighting for our first responders and family members. We are demanding answers, and we're demanding them now. Senator Schumer.
Thank you, Senator Gillibrand, and thank you for your great leadership here. I want to thank our advocates as well, John Field, Thomas Hart, Andrew Ansborough, Mariana James, and so many others. Now, we're here today because of our sacred promise, never forget. And that sacred promise is under attack. Ever since he was confirmed, Robert Kennedy Jr. has tried to gut the World Trade Center Health Program. Not trim, not tweak, not fix, but gut. Just look at the chaos that's been swirling over the last few weeks. Doctors and staff who manage and provide care to our sick 9/11 first responders fired, some rehired, others fired again. Total chaos. And this is the last place on earth where there should be chaos, because people are sick and people are dying and people need their health care. The firefighters and heroes who worked the pile, helping rebuild after the darkest hours in America, are sick with cancer from the toxic air they breathe and other illnesses as well. Many are dying. Is this how you treat their health care? Up to 800 first responders, up to 800 have had their enrollments halted. As many as 1,200 written treatment approvals have been stopped. These are approvals that are needed, whether it's for a medicine or a treatment at a hospital, stopped. And people get sicker. And people are less likely to live when that happens. As Kirsten said, Dr. John Howard, the great director, was sent packing. Then he was supposedly reinstated. For how long, nobody knows. He doesn't know. Now, this infuriates me. I met with Senator Kennedy before his confirmation. I asked him, would he protect the World Trade Center Hope Program? Kennedy looked me in the eye and committed to protecting the World Trade Center Health Program. He lied. Kennedy lied. He has broken that commitment, and now he'll have to answer for it, because I know there will be questions asked of him at the committee tomorrow. Kennedy told me he had friends, acquaintances who died on 9/11. Well, has he forgotten them? What about those people? He looked me in the eye and said, I remember those people. Democrats are going to hold Senator Kennedy's feet to the fire. We're going to demand answers about his betrayal of 9/11 heroes. We'll demand answers about the cuts and the firing. We'll demand answers about the chaos, confusion, and uncertainty. No more broken promises. No more empty statements from Kennedy. We need the truth. We need the truth on what happened and what they're doing at the World Trade Center Health Program. We need them to firmly commit and publicly to never cut this program again, never cut it again, to never cut the health care or the workforce of this program again. My message to Secretary Kennedy and to President Trump is this: if you think you can quietly gut the World Trade Center Health Program without a fight, you are dead wrong. Senator Gillibrand and I, and all the advocates here today, will never let up. The health care of our 9/11 first responders is not government waste, Mr. Musk, Mr. Vote, Mr. Doge. It's sacred human life. Gutting the World Trade Center Health Program is not efficiency. What it is a different word: cruelty, meanness, anti-American. The World Trade Center Health Program, because of the people here, many of them, took years to build. It took the courage of many folks. Some of the folks are here today, some of them are gone, who walked the halls and are now gone, succumbed to the illnesses they acquired on 9/11. But because of the work of those people and the people here, it's the law, not a whim, not a maybe, not if I want to, a law. And now Kennedy is trying to take that all away in the blink of an eye. The chaos and confusion that this administration has created will not blind us to the reality. What they are doing is not never forget. What they are doing is screw you. That's a total betrayal, and it won't happen on our watch. Senator John Field.
Thank you, Chuck. Sir.
Yes, sir.
I'm just going to say what everybody else is thinking. Kennedy, you're a fucking liar. It's that simple. The secretary is disingenuous. The secretary is uniquely unqualified to hold any government position. But what are we doing today? Are we talking about a bill we've been walking the halls of Congress to get passed that they took off the table in December? Are we talking about Dr. Howard losing his job and the 15 doctors being fired? Are we talking about restoring NIOSH? What are we here for? This is 20 years of bullshit that you guys keep putting in front of us that we have to fight. You know, nobody apologized after 9/11. Nobody. Nobody said sorry for making him sick, her sick, him sick. Instead, we created the World Trade Center Health Program. That was their apology. Create the World Trade Center Health Program, give them free care, health care, then make us walk the halls of Congress and get it extended to 2090. And then to gut it, you took your own apology away from us. Mm-hmm. So what are we talking about today? You know, if Dr. Howard was an illegal alien, we know his fucking status. Serious. What's Dr. Howard's status? What happens on June 3rd? See, when they gutted NIOSH and Dr. Howard got fired, a fragile fraternity of 140,000 people were up in arms. The healthcare stopped. Now they're all wondering what happens June 3rd. So we stand here today, we have to go back and worry about those 140,000 people who don't know their future. So what are we doing today? I mean, I want to talk about, we'll be back here next week having 30-plus meetings for HR 1410 and S739. So is Kennedy going to come out and make a public announcement before tomorrow's hearing when he gets a new one ripped? Because Senator Kaine, Senator Kim, I want to thank them because I know they've been watching this. So is he going to come out and publicly say Dr. Howard is permanently reinstated? Are those doctors permanently reinstated? Those doctors that ensure the enrollment and the certification process rolls? Is Kennedy going to come out and say he's not going to mess with us anymore? Is Kennedy going to come out and say, you know what, I support HR 1410 and S739? Is the administration going to support HR 1410? Because the administration can just say, hey, everybody in Congress, support HR 1410. You know what? There's a thing, that reconciliation that they're doing right now. They can slip us in there. We can all be gone, and John Field doesn't have to curse in front of everybody. But today, we're here, and what are we doing? We're fighting the boogeyman. Who's our enemy? Kennedy? He's an idiot. Again, grossly unqualified to hold any position in the United States federal government. What an incompetent, arrogant, dumb, stupid, repulsive fool to recklessly, without any humanity, hurt 140,000 people. If you're not angry, then you're not human. Have a good one.
Thank you, everybody.
Thanks, Chuck. I'd now like to invite up Thomas Hart, our president of Citizens for Extension of the Droga Act and president of Local 94, International Union of Operating Engineers.
Thank you. Thank you, Senator Schumer. Thank you, Senator Gillibrand. John, today we're here for two things. We're here to say thank you to the people who have continued to support our fight and our effort from day one. These people behind me and the people that have gone before you, people that have gotten sick, the people that have been shut down, have risen from the ashes and the chaos and the confusion. We know about chaos, confusion, dark times. These people answered the bell. They were there for it. Chaos and confusion are nothing new to us. We're pros at it. What's going on today is an atrocity. We're here today also, John, to hold people accountable for the things that they're doing. That's what's got to come out of today, tomorrow, and every day forward. People need to be held accountable for what they're doing. I hope that people have the courage to ask those questions tomorrow when he's sitting on that floor, because he is not qualified to do the things he does. John Howard came into a time of chaos, confusion, and probably produced one of the most successful programs that this country has ever seen coming out of this Capitol building. The man is a hero. The way he's being treated is completely disrespectful. Think about being diagnosed with cancer when you answered the bell. 15, 17, 18, 20 years later, you come down in the gestation period with cancer. Because in the deepest, darkest times of our country, in my city, the city of New York, it hit close to home. Now they're being told that they're not going to have anybody there for them. Nobody wants to talk about the mental health aspect of what we're dealing with. Think about that if that was your aunt, your uncle. Think about what they're thinking about. There's nowhere to turn. They're scared to death. The only thing facing them is death because we turned our backs on them. Never forget. I know in my local, we will never, ever forget. These folks here, they're never going to forget. And guess what? We're never going away. So tomorrow, please have your colleagues have the courage to stand up the same way these people have, and we'll continue the fight. Thank you.
Thank you. Now I'd like to invite up Andy Ansbro, the president of the Uniformed Firefighters Association for Local 94 IAFF AFL-CIO.
Thank you, Senator Gillibrand and Senator Schumer, for having us here, and everyone for coming back down again for this important work that we do. I come here representing 20,000 active and retired New York City firefighters, including all of the 9/11 first responders that are still alive, myself included. But I'm also down here this week for Police Memorial Week to represent my father, who he and I both survived the collapse on 9/11, and just almost 2 years ago, he lost his life to 9/11-related cancer. He suffered for about 8 years before the cancer finally took him. My family watched him waste away, and it was very heartbreaking to watch a loved one die, but we never had the worry that his health care wouldn't be taken care of, that he wouldn't be able to see the great doctors that we have in New York City. They wouldn't get the best care. Since Secretary Kennedy took the job, he's thrown chaos into this system. We have members that have received cancer diagnoses that have had their cancer treatment delayed. Delaying people's cancer treatment is putting them closer to death. I've had friends, young men, die 4 months after their diagnosis. Everyone that gets cancer has a line in the sand where they get treatment. If they're on the right side of it, they live. On the right side if they die. Delaying it a day could be pushing someone over that line and killing them. But the mental anguish you're causing to all of those people that are being treated, or people like myself that fortunately do not have a fatal cancer lurking in our bodies that I know of, it's still an uncertainty that what's going to happen with this program. Is it going to be put back together the way we were told it was going to be put back together? We're not talking about a mistake that was made yesterday. This mistake was made months ago. It was made several times, and it was also done. They did this program dirty when they took the funding piece out of the legislation at the end of December. That has never been restored. So for an administration and a president that ran on never forget and I'll always take care, you really hired a guy who can't get his shit together and take care of business and do what he was supposed to do. In his job, I would think he would have something along a Hippocratic oath, where at first, do no harm. And on day one, to cut all those jobs without knowing what you were doing and not restoring them is a disgrace, and we'll hold you accountable for it. And you better get it together because we're not going away. Thank you all for your time. Unfortunately, I won't be here tomorrow. My nephew is graduating from the academy, carrying on my father's name in the FDNY, but I know John and the rest of the group here will hold Kennedy accountable tomorrow. Thank you.
Thanks, Andy. Our next speaker is Mariama James, our 9/11 survivor.
Hi, my name is Mariama James, and I am a survivor of the 9/11 terrorist attack. I live about 4 blocks east of where Tower 1 once stood, and I've been in this fight along with the responders since day one, coming here in 2009, getting the bill passed in 2010, coming back in 2015 to get the bill reauthorized in 2016, coming back in 2019, I think I don't even remember what now, and then again in 2023 to expand, and then several times in between. And this is all while none of us are in the health to really be doing this. In 2015, I got laid off from my job, and I made the choice not to look for another one. And I've been a perpetual volunteer since, because I was too ill to look for another job and be committed to going there every day and working. I lost both of my parents to 9/11 cancer. Innocent people just living and or working in the area. My father was babysitting for me, so he was at my home. My mother worked at Deutsche Bank, so even though she lived, not downtown, she lived in Harlem, she developed cancer from 9/11. And there are a number of other people that I've known along the way and been close to along the way that are no longer here. It's like they're trying to wait us out, wait for us to all be gone. I had been in this photo spread back in 2006 that was like the first iteration of this Remembering 9/11 Heroes. And James Zadroga was in that same spread. The Dust Cloud Lady was in that spread, and others, and my family, my father and my 3 kids and I. And everybody in the spread, but my children and I, including my own father, is gone now. But those of us that are still here, keep using the energy that we have, the will, the strength, to continue to fight, because people like my children and responders that were 18 on the day are now part of our youth cohort, and they're going to need the care also. But they don't remember the history. They don't have the institutional knowledge that the rest of us have developed. Some of them don't even know their own stories. They need their parents, but guess what? Their parents are dead. That's what happens in my neighborhood. There's nobody for them to ask. They don't have their school records. They don't have stuff they need to prove that they're due treatment. So we're helping them fight also to make sure that they can be included in the program, because it's important to get the care. My mother's not here because during the pandemic, she was stuck in a nursing home, so she could not get to the World Trade Center clinic. She could not get the care, the specialized care that she needed. By the time she did get out and get to go to a hospital, her cancer had come back. That's why she's gone. So I'm here with these brothers today to ask that the funding gap finally be once and for all resolved, restored, passed the bill, the Correction Act, and don't have us come here anymore. None of us want to come here anymore. Thank you.
Thank you, Mariama. Our last speaker is Michael McGuire, the Laborers International Union of North America.
Everybody shivers as I take a big wad of papers out, but they're just notes.
It's okay.
So, I'm not going to rehash that day. I was in Manhattan that morning. Our office was on 18th Street, not too far north of the towers. And what I saw that morning was hundreds of thousands of people streaming north in Manhattan, going up the island, trying to get away from the hell that became Ground Zero. But what I also saw were tens of thousands of first responders, our firefighters, our police officers, our EMTs, our medical personnel, heading downtown towards the danger. The other group I saw going downtown towards that danger was building trades. The building trades responded immediately. There's a famous story. There was a tower going up in the East 90s. And the guys who were up on the tower, they saw the first tower come down. And at that point, there was no broadcast. TV was out, radio was out, all the radio antennas were all shut down, everything else, so nobody knew what was going on. The men and women on that job site of the unionized building trades in New York City streamed off of that job, commandeered a New York City bus to take them down to Ground Zero so they could get working on the rescue and recovery as soon as possible. It was these sort of actions that were seen all over Manhattan that day, time and time again. They were under no obligation to go down there. They just knew that their skill sets were needed and they could help, so they went. My union was part of that, the Laborers International Union of North America. We had upwards of 4,000 members down on the pile and on the rescue and recovery effort during the whole process. demolition experts from Local 79, environmental hazard remediation technicians, Local 78, a 3,000-member local. Almost every member of that local was down in the neighborhood trying to clear things up. But it wasn't just us. Literally every laborer's local in the tri-state area had people there. Nobody called them. They just went. 100,000 tons of debris was removed in the first 2 weeks, right? The pile continued to burn for 100 days. I don't know if people remember this. It was December 20th when the fires finally went out. The trades alongside of the uniforms, they worked tirelessly on the rescue and recovery and the subsequent cleanup of the pile. At the end of the day, the work was completed 3 months ahead of schedule and $750 million under budget. But here's the thing: in those early days, in those first 2 weeks, when 200 million pounds of toxic smoldering debris was removed, no one compelled the trades to be there. Contracts weren't even signed for the cleanup of the pile for months. It was actually in 2002 when the contracts got signed. So the trades were there because it was the right thing to do. There was work to be done. There was no, not to steal a page from John, but there was no time for bureaucratic bullshit. So here it is now, almost a quarter of a century later, and ironically, it's precisely bureaucratic BS that's forcing these heroic citizens to suffer and die. Slashing and burning this vital program, not based on efficiency or facts or need, but rather on political posturing and crackpot conspiracy theories, is an absolute disgrace. It's based on the fevered dreams of a delusional despot who, at the end of the day, will be responsible for the deaths of thousands of more Americans than were killed that morning in September of 2001. But it doesn't have to be that way. Reinstate Dr. Howard to his full power and position. Reinstate all staff of NIOSH that were working on the World Trade Center health-related issues. And frankly, Secretary Kennedy, resign. Reinstate the care standards and the ability to admit new patients to the program. We need that vitally. We're still getting 30 to 50 new referrals of new cancers every month at this point. If we do all those things as soon as possible, maybe the administration of this iteration of HHS will go down in history as saviors and not as the unnecessary cause of the deaths of more American citizens than any administration in history. Thank you.
Thank you. We're happy to take some on-topic questions if you have any. Go ahead.
Yes, I'd like to ask about Senator Kennedy's hearing tomorrow. You said you're going to be demanding some questions from him. What are some of those questions you will be asking him?
If all the personnel are reinstated, if they're reinstated permanently, if Dr. Howard is reinstated permanently, and if he's going to support the full authorization of all the resources the 9/11 health bill needs until the end of the lives of every 9/11 first responder. We need to know where he stands. Like Senator Schumer, I had long conversations with him during his, before his confirmation, and he assured me he would support the program. So this is intolerable and unacceptable. Go ahead.
The president is a native New Yorker, and I know he's dealt with many of you on this issue. Many were there at the Rose Garden when he signed the extension. And I'm just wondering whether there's been any communication with the White House, with the president directly, to appeal to him, given that this is a program that hits home to many New Yorkers.
There's been a lot of bipartisan discussions directly with the White House, with members of the New York delegation.
The president signed into law the VCF, the extension of the compensation side. This is the healthcare side. His comments were, he did it in his first term so we can all live a great life. If you call coming back to DC over and over again a great life, then your heart's not in it as a human being. Because if he really cared, he would tell Speaker Johnson to put our bill on the floor as a standalone or attach us in the continuing resolution.
Yeah.
I mean,
In the reconciliation bill.
This administration is silly. This is run by a bunch of silly people.
Come
that
speak
don't
in front of the
qualify.
mic, and the mics they have.
Did you hear all of that?
You can say it again.
Who didn't hear it?
Take it from the top.
Camera.
Take it from the top.
Yeah. Yeah. President Trump.
If President Trump really cared, he would have Speaker Johnson put us in reconciliation on the continuing resolution. If he really cared, he would have stopped the madness before it started. He claimed that he helped us in his first term by extending the Victims' Compensation Fund. We're here for the health care. You can't spend money when you're dead. You can't spend money when you're bedridden. You can't spend money when you can't leave your house. Well, you guess you can. You can go on Amazon. But the point is, he did not help us completely. If he really, truly wants to help us, then help us right now, today. Today, he can help us, and he hasn't. So I put him in the same boat as Kennedy.
Permanent funding? Yeah, it's about a $3 billion shortfall.
Yes, it didn't get into the CR in December because it was blown up. There was a push to try to do it in the CR from earlier this year that ultimately didn't happen. Where do talks stand on that?
We're trying to put it in any must-pass legislation. We would put it in the reconciliation. We'd put it in the next CR. We put it in any budget bill that is moving. And that's what we've consistently asked for the White House to do, as well as our Republican colleagues. Should have been in any bill at any time. We've been asking for bipartisan support for this forever. And so we just need them to do their part and Congress to do its job.
In 2010, the original statute for the bill calls for 138 people to be staffed under NIOSH to administrate the World Trade Center Health Program. We were at 93. If that bill would have got attached in December, we would have met the 138 criteria. There would have been no backlog on enrollment and certification. So they're doing double whammy in hurting the 9/11 community.
Any more? Go ahead, Mariana.
To the first gentleman that asked the question over here. Yes, to the right, sorry. One of the things that I would like for those who attend the hearing and the senator to ask is for the communication gap to be lifted. There's some sort of pause on communication. So those of us who are members of groups like the Survivor Steering Committee or the Responder Steering Committee, both of which are required under the bill to exist, we can't even communicate with NIOSH or members of the program or the CDC since this communication has been paused. And again, we're bodies that were created as part of the bill to make sure that it's being implemented properly. So that would be something that I would ask to change.
Yeah.
Again, this is more far-reaching than anything. The agenda here is very clear. All right, I'm a labor representative. All right? Department of Labor has been torn apart. All right, the actions of our secretary in HHS, NIOSH, OSHA. OSHA was born before half of you people in this room. It's been shredded. It protects working men and women, whether you're union or non-union. It's been torn apart for no rhyme or reason. It's time to hold the administration accountable for every move. I spoke at a town hall meeting Thursday evening. I was excited because people are turning out. They're waking up. It didn't matter what their issue was. There were a lot of issues that went around that room. People are pissed off. It's time to hold people accountable. What questions? Any question that is related to any of the moves that they've made. All of them are knee-jerk reactions. Nothing has been thought out. Nothing. You have sick people. Sick people. When she says she can't get somebody on the phone or an email because they're not there. They've been taken away. The safety net. So just imagine, and I'm going to go back to the mental health issue again. Just imagine what that guy is thinking about sitting in his living room in his chair when he can't get up and he can't go get his treatment or he can't get his meds. He's going back to those dark times, the things that we saw, the things that we share as a community. The law enforcement folks, they're trained to a certain degree. The building trades guys, that's not shit that we're supposed to see. And we don't know how to function with it. But we carry it every day. And now we're being told no. We're being told no. Think about that. If you have a family or a relative, it hits close to home. So please, hold everybody accountable.
What was your question?
Well, I was just going to ask, I imagine several of you will be at the hearings tomorrow.
We'll be there.
Thank you all. Thank you for coming. Thank you, guys.
Thank you.
Thank
Thank
you.
you so much. Thank you so much for being here. Thank you again. You guys are awesome for showing up. Really appreciate it. All well said, beautifully said, beautifully said. Thank you, gentlemen. Thank you for coming out. Appreciate you very much. Good luck for the rest of your week.
Okay. No,
Yep.
because the only ones I
You're gonna head back tomorrow? Tonight? Yeah.
remember, guys came down.
Yeah, you can't. Nor should you.
That's when they walked in
This
with
fight's
those people running away.
continuing fight.
That story
Yeah,
at the
sure.
time. Somebody
Yeah,
wrote about
great.
in one of the press in the papers. So she worked for years.
Finally get a good background.
I'll let them finish.
The TW member turns around.
One with a smile, one with no smile. No smile,
Just inspiring stuff.
smile.
Ordinary people